There's nothing more important than your health. But what are we doing as a community to maintain it, preserve it, improve it?
But we have to do something different. What we've been trying right now isn't working.
A lot of it is about personal responsibility and wellness. It's about working on these issues during our entire life.
My biggest frustration is the inability of our system to really help accommodate easier choices for people to make to become healthier.
I see a lot of people challenged with changing their behavior, which is really what needs to happen for most of them.
For too long, we've all been moving in the wrong direction. There's a new movement in Southeast Michigan, a grassroots effort to get us all thinking more about our health, move in a more positive direction, an effort to find real solutions to get us all healthier. I'm Lila Lazarus. What you're about to see is an attempt to change all that.
I've been in healthcare for 25 years and had a wonderful career and worked for great organizations. And yet, if I look at the statistics, the community that I serve has gotten less healthy in the 25 years that I've worked in it. And I know I speak for a lot of the healthcare leaders in our community that is not the legacy that we want to leave behind.
The situation's very serious. It is. And if we don't do something now, it's going to get worse. 6 out of 10 citizens are either overweight or obese. Over half of our community here is in trouble.
In fact, that's statewide. 66.2% of Michigan adults are either overweight or obese.
We cannot continue this process of lifestyle-induced disease that's so preventable, that costs such massive amounts.
We don't have room on our schedules to deal with all the patients who need to be seen. It's overwhelming right now. We're desperate for more primary care doctors, actually, to just manage the numbers of people who need primary care. It's a real project to try to help all these people. The expectation that we're going to be able to manage people, because in reality, people need to manage themselves, and it's our job to help them learn how to do that better. You know, people sit 8-10 hours a day. That's a big problem. We've got to start addressing those internal issues in the culture.
You need to take care of your body. You get one shot at it, and you need to take care of your body. It's not just about blood pressure. It's about living healthy and exercising.
It's looking at what a dollar can do at the store and what it can buy, and it can buy a lot more junk than it can buy fresh produce.
We just don't have time for the health any longer.
Being well is your job.
People are out there working 2 jobs. They're working 9 to 9 every day. They come home, they see their kids for half an hour, and then they got to put them to bed. Well, guess what they've got time for? Chicken nuggets.
It's actually getting worse. We're living longer, but we're sicker.
Southeast Michigan has some of the best healthcare facilities in the world, world-class medical schools. But why are we still such an unhealthy city?
Who doesn't enjoy indulgence? But we've become so indulgent, so tempting. Everywhere, the default choice is the unhealthy choice. The healthy choice requires more work than it should, and we need to change that community-wide as well.
We're not doing well. We're not doing well with people's health in Detroit. And in Michigan, they've ranked the counties, they've ranked 82 out of 83. Wayne County ranks at the bottom every year, year after year after year.
I don't know that we're doing especially well, but health comes down to individual choices. Those who want to be out and active are, and we have a long way to go.
When it comes to how we rank among the healthiest states, we're not in the top 10, the top 20, or the top 30. Michigan ranks 34th in the nation.
What I think is holding us back is that we've never focused on our health. We've let the health system take care of us. We've turned over our health to someone other than ourselves, and we've never been responsible.
There's 2 parts to it. One is it's your life. If you want to live longer, and not just live longer, but have a higher quality of life, because you want to be active, you want to enjoy all those years. And so you should have a true interest in doing that, and these simple steps can make a huge difference in having a healthier life and better quality of life. The other part is find something that's fun or easy for you to start with. Don't set goals that are so outrageous, but just start simple. Go out for a walk. I mean, it's pure Michigan. Get outside.
So if we all know what it takes to get healthy, why aren't we doing it?
We have to do something different. What we've been trying right now isn't working.
The most valuable thing we have is our health, bar none. And it's unfortunate that we find ourselves in the situation that we have today. We can solve this problem. We Americans can solve any problem. Once we put our minds to it and make an effort, we can make a change. The question is, how do we get people focused on this and get them to the point where they want to do this? That's the question.
It has to be a community approach. We cannot do it separately.
So now, the CEO of St. Joseph Mercy Health System has come up with an idea. It's called Join Me. When we come back, what Join Me really is and what it can do for all of us.
In many ways, hospitals are a sick care system or a disease care system, not really a health care system.
This is all part of a major shift in healthcare. We're moving from being mainly focused on treating the sick. Now health systems are reaching out, becoming more involved in and more accountable for the health of the community. Population health management, not just sick management, looking for better ways to care for our total health, body, mind, and spirit.
Feel, breathe, get centered, find peace, and move.
We're really listening right now. I think we have a commitment to try to make a difference.
It's something that every person has to come to grips with themselves, and so we're going to do everything we can to give people choices and hope they make the right ones.
It sometimes seems as though making a living is killing people. I would like to see that on a mass scale, there are more resources made available to subsidize people who want to proactively support their well-being, pursue their well-being.
We've done a great job really developing technology and expertise to help people in crisis. We are really good at that now, but we're realizing that old adage, an ounce of prevention is worth a pound of cure, and we can't afford to allow ourselves to just continue to develop diseases. And part of it is just connecting, as Join Me campaign has suggested, coming together, bringing our knowledge together, our inspiration together, and really taking it outside the hospital, because that's really where it needs to go. It needs to go into the community.
The CEO of St. Joe, an avid cyclist who truly practices what he preaches, started thinking, what can we do together as a community to make a change?
You know, who wants to be in the hospital? It's the last place you want to be. So we're really perfecting sick care. Meanwhile, we look outside our windows of our hospitals, our community is getting less healthy.
St. Joe's spent the first part of this year traveling city to city around Southeast Michigan, listening to your concerns, your frustrations.
Many people are not thinking about getting well until they get sick, and they don't want to be reminded that they're sick.
We have more people who have diabetes than anything. And then we have a lot of people that don't even know they have it.
Most people know what kind of fuel their car needs, what grade octane, but a lot of people don't know what kind of fuel their body needs.
The ultimate issue is personal responsibility. The problem with our healthcare system is we demand flawless healthcare with no personal accountability, and we want someone else to pay for it.
And it's about working on these issues during their entire life.
The call went out for people, businesses, and organizations to get involved.
So I'm excited that we're having this discussion.
The effort became known as Join Me.
I launched Join Me mainly out of frustration. And it was the frustration of trying to do a lot of great things and not feeling like we were making a difference. So the only way to do that is to yell at the world, join me in first feeling like we got to do something. Feel compelled that we have to make a difference. Then think about, all right, now that we are all excited, what are we going to actually do?
I think it's awesome, and I appreciate St. Joe's leadership on this. I've spent some time at St. Joe's, and one of the fun things I actually did there, I went to a cooking class there once, and it was about eating healthier. There's a lot of things we can do to reduce how many calories you eat and to actually have higher quality eating habits by doing some very simple things.
The Join Me initiative could be a foundation for helping people make these changes that we know they need to make, because it can't all happen in the doctor's office. We've got to create the infrastructure at work, at home, at school, even at church where you worship, to support better health.
Having a partnership and knowing that you have something or someone or an organization that you can rely on who's going to help you and help you pick up the pieces, I think that's really, really important. So I think it's a great idea, the Join Me concept.
Before we actually start developing programs and services at all of our locations and in our communities, we have to listen first. So this initial kind of lunch and learns that we did in all the communities was really intended to listen and come up with new ideas.
The Join Me campaign is a wonderful opportunity within a large set of hospitals that is going to hopefully bring people together around healthy eating, healthy movement, and a community of health that's going to change us into a culture of wellness.
People have different definitions of health. You know, some may think being healthy is running a marathon or getting on a bike for a century ride, or that I've got to eat great every day and I have to deprive myself of all kinds of different foods and everything. Some people think, oh, it's just getting out of bed in the morning and taking a walk around the neighborhood. It's really different for every individual. And really, it's setting personal goals and having personal responsibility.
As a family physician, I see people who've been in the hospital who are now discharged back to my care, and they're still confused. They're out of their crisis, and now what are we going to do? People need help with that because really they need to manage themselves, but they need the tools. And a lot of times the tools aren't just drugs, it's inspiration.
Those tools may also be needed here in the grocery aisle. Choosing the right foods, understanding labels, making better choices.
When you go to the grocery store, are you going to get what's on the list from the nutritionist or from the doctor?
Where's the diabetes section? You have to look down every aisle for sugar-free, if you can find it. There's almost sugar in everything.
We see a lot of great produce come through Eastern Market, from our wholesale to our retail markets. We know that Michigan farmers are doing their part to grow great crops that people can eat and be healthy. Somehow there's a disconnect between what's coming out of the field and what's going in people's mouths.
Yes, I'm supposed to go and I'm supposed to buy this produce. Great, you gave me a cabbage. Not sure what to do with this. Somehow I'm supposed to be able to eat it, but I don't know how.
Fast foods. Every corner is a fast food restaurant. I think that's the problem.
A lot of people can't really afford to eat the way they want to eat or should be able to eat. So they take cheaper measures, which is a lot of processed foods, which is unhealthy for us, like myself.
I see a lot of people challenged with changing their behavior, which is really what needs to happen for most of them. They need to move more and they need to eat better. And I think people are really stressed. I think stress is a really significant factor for a lot of people that makes those other two things more difficult.
Here in Pontiac, I feel like there's so little reach out to the community.
Men are the worst for taking care of their own body. And so they come to my office because their wife makes them come to my office.
I think this is the beginning of improving the health of not only ourselves as individuals, but our families, our communities, our organizations, and I think that that's what we all want, is a healthier community.
A lot of people are success driven. It's very easy for us to focus too much time at the office, not enough time in the morning working out, not enough time incorporating play with our children. So I don't know how we do that. If I knew that, that's what I would do. But I think we have to find a way to make it so that we can.
These lunch and learns have taught me one thing, that we don't know everything. And there is a lot of great ideas out there.
You started a movement here.
What do you think of this concept of Join Me? One person inspiring another to get healthier?
That's it. Detroit is an amazing place of each one teach one. I say this all the time. So if one person just gets out and makes a good example, everybody will follow. And Detroit is the place to start something like that, and you can see what we have with us.
We got about 5,000 people behind us.
Yeah, I say every Monday I get to ride with about 5,000 of my closest friends.
The ideas have been coming in fast and furious. In a moment, the first steps to a solution.
Before looking outward, St. Joe started this campaign looking inward.
It's really difficult to send a health message when you're not, behaving in a healthy way yourself. So one of the first things we did is pull the fryers out. We hired a very innovative chef. We completely transformed the food service because you can actually eat healthy and have it taste good at the same time. A lot of people think those two don't go together. They absolutely go together. And that was the beginning of our journey as we started to change our culture of health within our own organization.
Then St. Joe reached out, for your suggestions.
You don't need to run a marathon. If you love to run, go run. But if you love to dance, dance. If you love to garden, garden. If you love to walk, walk. If you want to play with your grandchildren or you want to dance around in the forest, go do what brings you joy. That's what we want to do, is help our friends, our family, our neighbors, our children understand that fitness means moving in your life and not just one cultural ideal.
Don't wait till you're 70 wishing you had exercised at 50. Do it now. Do it now.
I can't stress how important it is for all of us to hear that message and to wake up and start doing something for ourselves and start committing to being healthier. We need to start thinking about individual responsibility and accountability in this. And we need to start thinking about how employers communicate with their employees.
We need to move food from the autopilot being taken for granted in the back of our brain to the front of our brain and think about it a little more consciously. And I think that's happening, and I think all of us working together need to just accelerate that process.
When you move, listen to your body. You know, really tune in. How does it feel? I don't think it's all about exercise. I think it's really just about moving and enjoying what you do. Feel better. Feel good. Feel it. Enjoy it. The key is our bodies are very intelligent. We just have to listen. I mean, in listening to the message that your body's trying to give you and just follow that message, things are going to improve for you.
Well, this Join Me campaign is an excellent way for people around the community to just get together and just speak what's on their mind.
I think what you're doing here, getting lots of people involved to attack it from all different angles, is the key, including getting parents to understand what is the right thing to do for their kids.
Slowly but surely, we're seeing a change.
As of tomorrow, our campus will be tobacco-free. So that's something that's new. So that would be another thing that Eastern has done to take the next step in towards making the campus more healthy, make healthier choices.
Today, we just came down here to try a new vegetable. So they just tried a new vegetable, and we incorporate that all the time, trying different things that we've never tried before. Even if you don't like it, you don't have to finish it, you just have to try it. And we are very, very active, so we just push those things. And I think it's about doing those things early and making them habit, and then it's just that thing you always do.
Michigan cherries, 2 boxes. The farm markets are a great start. I love them. I would say more education, better food labeling, showing how much fat is in a food, how much fiber's in a food, how to equal it out so you are eating healthier.
About 6 or 8 weeks ago, I joined Weight Watchers, and I thought, it is up to me. It's up to me to figure out what's good for me. We have to start with us. I mean, it starts with that person in the mirror.
What we're trying to do is create opportunities, to create soccer leagues, to get the parks open, to get the riverfront walk open, to get bike lanes open, to get more stores in the city. So we're creating opportunities and hope people will take advantage of them. The progress we're making is a result of people working together, and hopefully we'll keep doing it.
If they can certainly exercise more, and if they can increase their intake of healthy foods, we know that that will significantly impact not only their health in the future, it will significantly impact our healthcare costs in the future as well.
Yesterday, I swam the length of the pool for the first time, and I felt really good about it. And really, it was sometimes hard work to get out there in that water. There was a little bit of fear, but I worked through it, and yeah, I felt good about it.
Inhale, now your left arm can go back up towards the sky. Thumb in line with mouth. The twist and the depth of the twist comes from the spine, not from the arm.
It's contagious. Good health is contagious. When people feel good, you say, like, I want to feel like that. Like, what's that person doing? Wow, set an example. Others will follow. I mean, feeling good is contagious.
There's a lot of great work being done by St. Joe's, by many of the other health systems, by businesses, by communities. So much great activity. We're working with Eastern Market to be their nutrition sponsor. We're even looking at partnerships with other health systems so that we can work together and leave the competition at the door.
We really believe that health and well-being drive the economy. Actually, that's kind of like a chicken and egg as well. What came first, the healthy economy or the healthy people? I believe in order to bring people, bring organizations and business into our community, we need to really focus on making sure we have a healthy population and a healthy workforce.
We all need to work together on this. This is a partnership that we all have to be involved in the future if we want to see real change. Everybody from our large health systems to our hospitals, our public health departments, even our community mental health agencies where they see people who have issues that come into play that may affect their health, we all have to be involved.
This is a journey. We're all on a journey to better health, and we're taking this journey together.
We can't do this alone, and we got to rely on a community approach to this. So I hope that our efforts will help to leverage our resources with those of others in the community and to build some real collaboration around these efforts.
We won't change the world overnight, but we can change it one day at a time.
Let's do better, and let's help one another, because again, it's not just about living longer. It's about higher quality of life. Watch your diet, be more thoughtful, exercise, avoid tobacco, get an annual physical. Manage your blood pressure, your blood sugar, your cholesterol, and your weight. If you do those things, you're going to have a better life, and it's better for all of us.
What's next? We want you involved, interested, finding ways to live your healthiest life, and then sharing those ideas with the rest of us. We want you to be a Join Me ambassador, working on your own health and inspiring others to do the same.
I want to look back in my career and know that people got healthier and enjoyed life. That's what weighs on me all the time. I've got a few more years left in this, and I'm going to go down swinging. We have to reverse these trends, and we have to do it now, because it's getting worse, and we can't afford to let it get worse.
The movement is growing. Get more information at stjoeshealth.org/joinme. I'm Lila Lazarus. Thanks for watching.